So thanks for that lovely intro. The goal of my talk is to try and sort of fit into the rest of the conversation that we've been having with both Dr. Amit Sethi as well as with Shalini before me to show, I think we're seeing different ways in which we can enable and impact patient outcomes, especially child outcomes in cancer, outcomes in children in cancer. And the approach that Navya has taken is to use technology, a lot of the stuff that Dr. Amit Sethi was talking about a couple of presentations ago, and roll that into a human-oriented service that essentially leverages the patient advocates and the experts that are actually on the ground and doing the work to put it together into a service that solves these access of care issues. So my goal is to introduce you a little bit to the scope of the problem and to what TMC NCG Navya actually does. What is a service? How do we actually solve this problem of access to care for pediatric patients and adult patients across the country? And to actually spend a little bit of time going through the different validation and impact studies that we've done to show the kinds of changes that we're capable of making on the ground. And the general synthesis that I want people to take away is that, I think there's a lot of glamour around AI and ML and technology. And, especially in the US, there's this cancer moonshot to try and look for, a complete eradication of cancer, et cetera. And, we took this inspiration from one of Dr. C.S. Pramesh's talks that in technology, sometimes Earthshots can give you a long distance and give you a long lift in the outcomes that you're looking for. And perhaps that's even better than looking at something that's 20 years or 50 years down the line. And so I think if you look at the synergy between how technology and humans, services and expert services can work together to solve problems, you can get some pretty beautiful impact that I'm happy to share with you. So the problem is something that some of us are already very intimately familiar with. Tata Memorial Center and other academic centers are in urban centers like Mumbai or Delhi, Chennai, Bangalore, for example. And in TMC in particular, even though the academic center is in Mumbai, patients travel all the way from the east, from UP, from the north, east, and then around the country to get to TMC. And this, especially in pediatric oncology, is significantly worse because there's very few pediatric oncologists around the country, and there's a lot of travel cost and time that essentially is spent on traveling. And why are patients traveling? Well, they're traveling to get care, but they're also traveling largely in order to know that they are getting the best decision for their child. If surgery is possible, they want to know that. If radiation is necessary, they want to know that. And this decision is often the single most expensive item in healthcare. In other words, radiation costs a lot, but the spend on radiation doesn't even happen if you make the wrong decision to not radiate. So the medical decision is actually what drives a lot of healthcare costs and a lot of healthcare effectiveness. So making the right medical decision can actually have a huge impact on savings on both medical costs as well as on time and the right cure. So both patients are very intensely aware that they want to make sure they have the right experts that they're reaching. There's a lot of timeliness on how quickly they get an answer. They have an explanation for why their child has to go through a certain therapy. And they need this peace of mind that everything that they could do is already being done. Experts, on the other hand, are seeing 60, 70, 80, 90 patients a day, as we saw in that video. And they need to focus on critical decision making, minimize overhead. They need to be able to give the right answer with compassion and empathy without spending enormous amounts of time reading records and reviewing paper trails. And so this is a system where it's really the sweet spot for AI or ML to come in and really assist the work of the experts to be able to deliver to the patients what they are being challenged to deliver just because of the vast numbers of patients. So this is really in that sweet spot where technology can play a big role. And that is where TMC NCG Navya, the service TMC Online that was launched in 2014, really takes its place of pride. So the way that Navya works, just so that everyone's familiar, is that The interface of it is completely human. So a patient uploads their records on a website, a patient advocate who's very empathetic, who speaks their language, calls them up, reassures them, collects their records, makes sure that the patient knows what they have to expect. So we hide all the technology behind the scenes so that the patient is not forced to fill out lots of forms and go through software and an engine. But then on the back end, what we do is that we take the patient's medical records, and I'll show you an example of this, and we put it through our software system where we structure all the data into, like, so we know what the diagnosis is, what's the molecular markers, and we're able to map it then to clinical trials that are in our database, previous patients who've actually undergone recommendations at TMC and at NCG centers. And we're able to generate this short, crisp case summary that only takes doctors a couple of minutes to review. So that's the main USP, is that instead of the doctors taking 20 minutes or 15 minutes telling the patient, I'm missing this biopsy report or I'm missing this MRI report, the technology and the human analyst does all the work to structure it so that the doctor can give us an answer within a couple of minutes on a mobile app. And they can collaborate with each other on this app to basically say, I would do this, I wouldn't do this. And that generates a multidisciplinary answer to the patient that can go back to the patient. And we're able to complete most of this cycle with a median time of 24 hours. And that is extremely important for our patients, as I'll explain to you in a second here. So the scope of the problem is huge. We see all kinds of reports, handwritten reports, images, photos of medical images, text records. But what the doctors see is through our system is something that's very clean and simple that looks just like this. It's a short case summary that's available on their phone, which says that, oh, the BRAF mutation was negative. The PDL1 was positive at 90%. And then the treatment plan, the decision support already comes out in the mobile app. So where the doctor can either click on it and say, yes, agree, or they can ignore it and they can write a comment here saying what their treatment plan of choice is or why any of these treatment choices may not be applicable to this child. And this whole process only takes about 2 to 5 minutes for the doctors per case. Now that gets converted into a really nice patient report in very simple language English, point by point, where we explain everything to the patients. And then on the phone, we'll go over and explain it in Bengali or Hindi or Marathi or whatever the patient also needs, so that we do a lot of hand holding. So even though there's a lot of technology that goes into this, how do you get from here to here quickly? Well, you have to use technology, otherwise it becomes too overwhelming. And similarly, how do you get from what the doctor says to here to the patient report? There is a lot of technology behind it, but the patient is really exposed to the service and to the patient advocate. So I want to spend a little bit of time here, now that you know how the technology can actually be put into a service, to walk you through the impact of technology, the impact of the Earthshot. And we've presented at SIOP in 2018, 19, and 2020. In 2019 was an oral presentation where Dr. Tushar Vora presented on behalf of the pediatric DMG at TMC as well. And I want to just summarize some of those key highlights so you can see what the impact of a service like this in our country on our patients, adults and pediatrics, can be. So this was an adult overall patient study that we looked at both adults and pediatrics and presented at ASCO in 2017, where we wanted to see, are these reports actually making an impact on the ground? And in an oral presentation, we actually shared, looking at more than 1,000 consecutive patients, that 72% of patients shared the report from the Tata and the NCG experts with their treating oncologists. And more importantly, whether they shared it or not, they were able to influence the final treatment that the patient actually received. 80% of the time, the recommendation from the Tata doctors and the NCG doctors was the final treatment that was actually received by the patient. So this was seen as a pretty practice-changing thing, that you could use an online service, an AI-enabled service, to essentially impact treatment on the ground, that patients would carry it out. We also submitted results at SIOP for a pediatric cohort to show the significant amounts of time and cost savings, where patients, especially when they weren't receiving subsidies or they weren't able to reimburse their costs. I mean, Shalini spoke beautifully to the problem of costs that these families are spending, easily 50,000 rupees, a lakh, more than that sometimes, just in being able to leave their hometown, bring their family, lost income, travel to TMC, spend weeks at an academic medical center. And instead, we have created an ecosystem where through CSR and fundraising, we're able to completely sponsor and do these opinions for free for patients who are underprivileged, thereby doing a lot of cost savings for the patients, and to return an answer within 24 hours instead of 3 to 5 days for them to have to get through. And mainly for the experts, instead of spending 20, 30 minutes reviewing a case on telehealth or telemedicine, they can do this in 2 to 5 minutes so they can scale. So this was presented at SIOP, which is, a major impact statement for our technology. Finally, this was from last year, both at SIOP and at ASCO. And we asked ourselves the question, well, 80% of our patients are getting a treatment recommended by TMC and NCG doctors, but what's the change in decisions? What's the actual impact and change in decisions? And what we were able to show is that before Navya or without the Tata NCG opinion, about 30% of patients were receiving guideline non-compliant care. They were missing a key piece of treatment like a radiation or a targeted therapy or a mutation test, et cetera. And after going through the service, when you compare it to the NCG guidelines and the NCCN guidelines and the pediatric guidelines as to what should have done, not only were we providing them the guideline compliant plan, but there was an actual 50% change in decisions on the ground. If you think of the impact of most medical technologies, they're extremely expensive, and sometimes you see a 5% change, a 4% change towards guideline compliant care. Changing physician and patient behavior is incredibly difficult. But through the use of technology and getting to patients very, very quickly with a warm patient advocate, and having the emphasis of the Tata and the NCG doctors who've reviewed it holistically, we're able to create a huge impact and a change in on-the-ground decisions. If you're one of those children who's starting out over here, being able to change into guideline-compliant care is really what influences your outcomes. So we study all of this pretty deeply and present the data just to show that it's not just pie in the sky, some imaginative, I can recognize this, I can recognize that with AI or ML. We're actually making changes on the ground with treatment decisions. And we're one of the few technology initiatives that actually keep studying ourselves just because we have that ethos from TMC and from NCG that it just has to keep getting proven and the impact has to keep scaling. Time, why do we care about 24 hours? Because we found that the first 24 to 48 hours after the patients have a biopsy result is really when their planning, their anxiety is at their highest. And so if you can get back to them the first day, the second day, the third day, as soon as that PET-CT result comes back, as soon as that MRI result comes back, they have significant anxiety relief. If you get back to them a week later with an appointment, and it could even be a telemedicine that they've been waiting for, a week later, by that time, their anxiety has really built up. So getting back to them immediately is one of the uses of technology. We cannot do this alone. We do this through a huge network of NGOs, nonprofits, CSR donors, experts in the National Cancer Grid, and scientists who work with us to continue to validate the system. So we work with a lot of pediatric nonprofits, including the pediatric groups at TMC, with CanKids, Ummiden, VCare sends us a lot of patients, and this whole ecosystem of working with the NGOs and the nonprofits around the country is how we're able to really reach the children across the country. And we have experts from the NCG. So TMC is a big part of our expert panel, but then we have experts from the NCG centers all across the country. There's about 150 centers, and we have many champions from across India who are supporting the work of TMC NCG Navya in reaching patients everywhere. So with that, I want to wrap up just to show you that cancer informatics and AI ML solutions can be combined with warm human empathy and patient advocates to provide a scalable and accessible service to patients. This can be timely, it can be cost effective. It's a meaningful way to make an impact to patients and change cancer care in India as well as globally. Thank you, and that's our thesis.